So, hi friends, we have Dr. Sushant Sarang with us. He is a senior occupational therapist. He is the associate professor at KEM in the Department of Occupational Therapy, and he's also the ex-convener of Bombay branch of All India Occupational Therapy Association. He'll be there to answer a few questions for us. Let's welcome him. Hello, Sushant.
Hi, Rina. Nice talking to you after a long time. How are you?
I'm good, very good. And it's nice talking to you also. And thank you so much for giving your time
Hi.
for helping us out with such an important topic. Hmm?
Completely my pleasure.
But there are some parents who I talk to, and I'm sure you talk to also, who say that therapists don't give them a home program. So, does every therapist give a home program? And what if the therapist doesn't give? A parent can ask for a home program, right?
See, therapy is only for 45 minutes. At some centers, it may be 1 hour, but on an average, 45 minutes is the standard therapy session. So the child is with the therapist only for 45 minutes, whereas the work on the brain or the synapses in the brain is happening throughout the day. So everything that the parent talks with the child, every activity that the child does at home, at play, or whenever he's out at school, there is something that is happening within the child. So having a home program is of utmost importance. At times, the therapist may give you a written home program, or at times they may just tell you verbally what is to be done, and then again ask you the next time, did you do this? And then you can take it follow. You can follow it up. But it is absolutely important for the parent to ask for a home program to the therapist.
Got it. Got it.
Whenever parents feel that there is no occupational therapist around, they start checking out on YouTube of certain activities, and then there are people who would claim that if there is a tactile issue you do this, if there is some other issue you do this, and there are various sensory activities which the so-called person shows on the videos in on YouTube. The parents should not do that. See, here we are talking about a very precise activity that needs to be given to the child. So, an activity which has worked for child A would not work for child B. In fact, that particular activity can be detrimental. It can further take the child back. Okay, there was a child, who was coming to me, and before coming to me, they told me that what, there were no occupational therapists around. So I watched these YouTube videos, and they said that you should do brushing. So we were brushing, we were using a particular brush, and we were doing that. And I said, what was the child's reaction? No, 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 he did never liked it. He in fact used to cry and he used to howl. So now this particular activity given to the child was contraindicated because they were not supposed to do it this way. The child was not ready. So one, even if it is say, even if the child has tactile issues, and if brushing is one of the activities which even this therapist will give, a proper therapist, still when to give, how much to give, what would be the texture of the brush, when to stop it, all these things would make it effective. And if that is not happening, then it may be detrimental. So, a sincere request to all parents, please do not think that activities are very simple. Somebody may tell you that you do this activity. No, there is no activity which can be given to all the kids generally. It has to be tailor made.
Mm. So, is there something like a fixed fee that every OT would charge? Or I'm sure, I mean, everybody knows this. Every OT would charge on the basis of expertise and the amount of years that they've put and the experience and all. But what is the range? And like, can you give some idea there?
So one is there is no fixed fee. There cannot be a fixed fee. Because as you rightly said, it would depend on the expertise of the therapist. So somebody who is a fresher may charge a particular amount, and somebody who is experienced would charge more, and that is true in each and every field. So there is no fixed fee per se.
I have a lot of people who tell me that my therapist comes home and does the program for my child. And there are some parents who say, we go to a therapy center, and they ask me, which is better, therapist coming home or we going? What is better according to you? Or is it just convenience? Or what are your views?
So one is, would both the therapies be effective? Yes, they would be effective. Huh? But if you ask me to choose which one would be more effective, then if you are going to the therapy center, that would be more effective for the simple reason that the child behaves differently in different setups. So if the child may behave in a certain way at home, the child may behave in a certain way at school and on the playground. Now, if the child is comfortable in the house, and if the therapist is coming and taking activities in the house, the child would not get the opportunity to experience adaptability in a different setup with different people in the absence of his family members who would be right there next to them, because most of the times the parent sits outside of the clinical area in the visiting area. So then it was always better that the child comes to the therapy center, and of course the therapy center is more equipped. No matter how much you try to equip your house, there is still a limitation. Plus there are other kids who are coming to the therapy center, so looking at them, looking at the group therapy also which is taking place, that again is useful. Still here, a few parents may say that, you know what, all these individual sessions are at home, but we go once for the group therapy. But it is not only about the group therapy part. Even on other days when there is individual therapy, if the child is there and if he is looking at other people, looking at other therapists also, even that makes a lot of difference.
Hmm. So I have a lot of parents who also tell me that, my special educator is also doing OT and also doing speech therapy, because she worked in a center where she observed therapists, and now she takes care of special education, OT, and speech therapy. So that's how I'm doing therapy with my child. What are your views about that?
So special education, occupational therapy, and speech therapy. These are three different professions which have proper courses which are conducted. So an occupational therapist cannot do the work of a speech therapist, and like vice versa. The same thing goes with the special educator as well. Generally, a special educator who is good in her special education knowledge would not have the time, energy, and inclination to do somebody else's work, because this person has so much knowledge to give, so much expertise to use for the child in his or her field itself. So to answer you shortly, if a person is saying that I do the other professions part as well, that is incorrect. The person cannot do it. An occupational therapist cannot do what a special educator does or a speech therapy does. At the same time, a special educator cannot do what an occupational therapist does and or a speech therapist does. Apart from it being wrong, unethical, it is illegal as well.
Okay. So thank you, Dr. Sushant, so much for all your valuable tips and suggestions, and sharing the knowledge with us. Thank you.
Thank you. Thank you, Rina. My pleasure as always. Thanks.